welcome to the panel this afternoon, the Internet of Healthy Babies Things. I have some really interesting panelists with me here today. Before I get started, I just wanted to say I'm Lori Jennings from Good Housekeeping Magazine. Obviously, tech and baby innovations are big for us, and we're familiar with many of these companies. We've tested many of the products, some of them that aren't out yet we haven't tested, but we are very much looking forward to testing them. I'm just going to quickly ask each person to introduce their product, introduce themselves, and tell us a little bit about, to start, what brought this product to life for you. Was it a personal story? Was it a personal challenge? Was it a light bulb moment in the middle of the night? I'd love to just know where these stories, where these companies and where these products came from. We'll start with Kurt.
Sounds good. Hi. Ooh, pull it up. Can you hear me? Okay, there we go. My name is Kurt Workman, one of the co-founders and CEO of Owlet. We make a wearable health monitor for babies that tracks their heart rate and oxygen levels and can send that to your smartphone. When my wife and I were, talking about starting our family, we were visiting her. Can you guys hear me? Is it kind of echoey?
It's a little echoey, but I think we can get by.
Try closer. I'm good. Okay. We were talking about starting our family, and we were visiting her cardiologist to see if it was okay to get pregnant, because she's had 3 heart surgeries, and we didn't know, if it was safe. And she's doing just great, but we were worried. The doctor told us that what she has could be hereditary, and our niece had also just had heart surgery as well. And so we were really concerned about that. And my friend told me about this technology that they use in the hospital called pulse oximetry. And it's just this little red light that they put on your finger, and it can track your heart rate and oxygen levels. And I thought, man, as a parent, that would make all the difference for me, just to know that my child's okay. And I think when we think about deep human needs and solving, real human needs, I can't think of anything that I would prioritize over knowing that my children are healthy and safe and that they're okay. So we started. It's been about 5 years since we initially had, the idea, and we made a little video with our smartphone, sewed a little sock together, and put a Radio Shack light in it, and made a little video, and it got picked up by ABC News. Started to get hundreds of emails from parents, and asking if they could buy a prototype. We're now available in Babies R Us, Bye Bye Baby. We'll be in Target, Best Buy, and just a lot of people have used the product. We've sold almost 200,000 monitors. And we've had just some incredible stories where Owlet has helped parents intervene when their baby needed it most. So,
hi everybody. This is I'm Jeff Cutler. I'm Chief Revenue Officer of TytoCare. TytoCare is the industry's first ever remote examination platform. We have a base device that has sensors and cameras built in, and then through various attachments like stethoscopes and otoscopes, it enables a patient to conduct a complete remote physical exam and collect their examination data for either sending to a doctor for later review and diagnosis, or to conduct a live consultation. So in essence, if you think about virtual consultations, telehealth being limited to audio video, we are the first FDA cleared platform that takes that beyond audio video to encompass a clinical quality remote physical exam. Our company was started when our CEO and founder, Dedi Gilad, who has a background in medical device engineering, had a toddler with constant ear infections. And as many of us have dealt with, found himself every week having to take his daughter to the hospital, when 9 out of 10 times everything was great. And he started wondering and saying, with some of the modern sensor technology, there's got to be a way for me be able to have my daughter's ear examined without having to miss work and everything else. And he set out on this journey with his partner about 6 years ago in 2012. We're Israeli based. We got our FDA clearance last October of 16. We opened our US office in New York City about 2.5 years ago, and are currently rolling it out with large strategic health systems and other partners that are starting to adapt this as their remote examination platform for all sorts of different use cases, which we'll talk about.
Hello everyone, I'm Yun from Comper. It is a company established in Silicon Valley, and then moved to Beijing, and we are now based in Beijing now. And our product is a fertility tracker for women. We have some smart devices focus on the health of women. Because I used to work as an obstetrics and gynecologist in the best hospital in Beijing, and in our hospital, when women come to ask us for experience of pregnancy, we ask them to use the traditional thermometer and to record their temperature, the basal body temperature on a paper, and to calculate which day is the perfect day for them to be pregnant. But nowadays, we use a smart device, and the app will calculate the temperature and to draw the curve for them. That will help them to ease their anxiety and to know the date of pregnancy more precisely. Yeah.
Hi, I'm Zheng Yang from Mira team. Okay. At Mira, we are building a quantitative hormone tracking solution for women who try to get conceived. And we use our cloud-based AI to learn from their menstrual cycles and provide them a better understanding of their menstrual cycle and provide them precise and personalized fertility information. So this project started about 3 years ago when myself and several of my friends, they suffered a lot from trying to conceive, having baby, and some of them even went through the IVF. We are a bunch of engineers, scientists, and OBGYN doctors. We think we can make a better solution, more data-based solution for general consumers. So we start a team of 20 right now, and we got this product FDA registered last year, and also got CE marked this year. So we want to help the women more personalized way, provide them personalized information. So
That's great. Hello? That sounds great. So it sounds like AI is something that is fueling a lot of the growth here, at least on the fertility tracking side. How does AI figure into the plans of the future for the other companies on the panel?
So at Outlet, one of the biggest issues the first year of life are, taking your baby in for a primary care visit or an ER visit. It's very common. And the number one reason for ER visits are respiratory infections. And, that's just an infection that's gotten down in the lungs, and it makes it harder for the baby to breathe. So oxygen levels are actually a really good indicator of whether or not a baby, that infection has become severe. And we're building models to predict RSV. We've done some partnerships with some of the large insurance companies to try and predict, if a baby's going to be admitted to the hospital, so we can get them seen by their physician earlier. So,
with TytoCare, we're using advanced analytics and diagnostics and AI in order to better manage the patient's family as well as the population as a whole. If you think about it, it's kind of shocking, but when it comes to healthcare, there just hasn't been digital data available before. Images have not been captured. Heart and lung sounds have not been captured. So we're really entering a whole new world of what can we do once this data gets captured digitally. So for example, as we build up image banks, for instance, of a family's ear, we'll be able to over time say, by the way, your daughter's infection looks very similar to an infection she had 2 years ago. And we'll be able to inform the doctor of that information in order to provide better health care. We'll be able to do analytics on the vast amounts of data that we're capturing to identify things like, truly, what does strep throat look like? Amazingly, no one ever knows that because it cannot be identified visually at this point. So over time, we're hoping to improve healthcare, better manage the population by being able to do advanced diagnostics and AI on the actual digital exam data that we're capturing.
For our product, I think AI helps women in 2 ways. First of all, you all know that there are a lot of people in China, and it will cost us a lot of time and money and energy if we want to visit a doctor. And nowadays, we use a smart device that we can know our just at home. And the other thing is that basal body temperature, we call it BBT, is proven scientifically to be a very easy and accurate way know the date of ovulation. So the problem is that the measurement should be very accurate. But if a woman who hadn't undergone medical training, she may not have her BBT record very precise. So nowadays we can use smart device to help her to record the temperature and to know herself better.
As a computational scientist in this research area, we have more than 10 years experience using machine learning-based AI in the research field. But for the baby tag, for this kind of healthcare area, I think it's a lot of space to get applied with AI. It'll help the people, the general consumer, to address their health issues. So it's our first testing field. I think it will be benefit a lot for the general consumers.
That's great. So in terms of, what is leading the adoption rates among consumers? I mean, what do you think is making these products grow in popularity so quickly? Anyone?
At TytoCare, we're seeing a tremendous adoption, primarily fueled by people's acceptance of wearables, trackers, that has really increased sort of that quantified self, that ability to be able to monitor and measure our own health and wellness. The other thing that we're realizing is just everybody expects anything they do anymore to be app-driven and on demand, whether it be your banking, calling a car service, even meeting a potential date, but not in healthcare. So people are looking for that. The ability to actually deliver app-driven, on-demand healthcare, we're finding, and the desire for that is really fueling a lot of interest and growth.
Yeah, I would say, every parent goes to check on their baby. We all do it in different ways. You poke them or you sneak in there like a ninja. And so there's just this existing pain, and new technology has allowed us to go a little bit deeper into the home to gather information that can help people. And so, 6 years ago, Fitbit wasn't a big deal. It wasn't like there was just all of these sensors on everybody. But this technology wave has enabled us to solve real problems. And I think, trying to conceive is a real problem. When my son is sick, you're trying to decide, do I go into the doctor or do I stay home? And it's a very qualitative analysis as a parent. You want to make it a little bit more quantified. And so tools like TytoCare, can help you answer those questions. It's a huge pain that I think exists. And now technology is just enabling us to answer those questions in the home. And parents want that because it is such a big pain.
I think these days women have a lot of pressure on how to balance their work and life, especially in big cities like Beijing. So they need an easier way to manage their life, especially to have a baby in their best days. So we just need to have a helper, yes, and a very private one.
Has cost factored in, do you believe, in any way in terms of improved or enhancement to how the products are being adopted, or is it a deterrent for people? Cost.
So the same technology that Owlet provides, this pulse oximetry technology, in the hospital, it's a $3,000 box with cords that go into the crib, and the leads from the cords need to be replaced every day. So it's $50 a day for a new lead, that sensor lead. It's very, very, very expensive. And now that Fitbit and Apple Watch are ordering these sensors in the millions, tens of millions, the cost has actually dropped dramatically. So you can have this hospital-grade technology at a consumer price point. Video monitors were $250 a couple of years ago. Now they're what, $70 if you get on Amazon. So I think the technology wave that we're seeing here has a lot of application to baby and has made it very affordable. I mean, $300, if you think about it, that's how much our product costs. Isn't a lot of money to spend if you're feeling anxious about whether or not your baby's okay. You'll spend the money. And $3,000 probably a little bit further outside of the affordability range. So,
I agree with Kurt completely. In essence, we're pricing Tyto at $299. So we also found sub 300 seems to be an attractive price point. But to think about that, there are numerous sensors and thermometer and all sorts of capabilities built into this previously unavailable for the consumer. And our hope over the next couple of years is actually drive that price down to below $200 and maybe even ultimately below $100 as a consumer device. Now that compares to, as an example, just a high-end digital otoscope, something like a GEDMED unit, is going to cost thousands of dollars. And that's a single-use device as opposed to a consumer-friendly multi-use device. The other thing we're also finding is if we can truly help improve outcomes and better manage population health, there's a lot of folks willing to subsidize something like this, whether it be employers as a benefit for their employees, whether it be a health system or an insurer to better manage some of the chronic conditions that are costing them most of the money. I mean, for those of you that aren't aware of it, most companies are finding that about 50 to 60% of their cost their medical expense cost goes towards managing these chronic conditions. So we're finding that while cost is an issue, its ability to save money and improve outcomes far outweighs it.
Of course, our tracker is more expensive than the traditional thermometer, but when you use it as a fertility tracker, it can save your time, and the more important thing is that it can ease your anxiety. That's very important. It has already been launched on Amazon, and its cost is $89.
Does one item, like, does it run out after a certain amount of time?
It can be recharged, so you don't need a battery. Yes.
I want to think about the cost as an aggregated total. Think about it, it's $2 per day for our product, over multi-$1,000 for IVF, and also the cost for women go to hospital to do their tedious routine check. So that we will thinking a different way.
So in terms of cost, sounds like you've got the cost thing figured out, which is great. What about the marketing messages? I mean, what do you feel works from a marketing perspective when you're talking to new parents or women who are trying to conceive, or just people in general who are really concerned about health? Anyone?
You're the chief revenue officer.
As we just heard, I mean, overcoming issues like anxiety and fears is a big motivator, and obviously something we can market to. But it's also just the convenience to be able to have a portable examination kit that you can take on vacations on the home. We're rolling these out. We've already rolled out a couple hundred in schools for school-based telehealth and folks like that. So when it comes to the marketing, I encourage you to come see our booth. We are literally just 2 aisles over, right behind that big metal monstrosity that's making all that noise over there. And we'll give you a demo and show you some of our marketing materials. But things like being able to do a checkup without a check-in, or being able to not have to take your kids into a crowded, germ-infested doctor's office. All of those are the types of things that we're finding. Being able to have instant access to a specialist. Those are the types of things that we find resonate as messaging most.
I'll jump in. I think two things kind of work for Owlet when it comes to marketing, like our marketing secret sauce. One is that, parents need less technology, and they believe they need less technology, and I think we talked about that. So it's really about solving, a problem, something that they're worried about, or a job to be done. And so if we can help them understand that this solves a problem for them, then they're willing to invite technology. But otherwise, it's actually it's not an early adopter category. If you look at like crowdfunding for baby tech companies, the majority of them have failed miserably. It doesn't mean that the products aren't great. They're just not early adopters. So that's part of it. I think the other part of it for Owlet is that the big glaring issue is SUIDs or SIDS. There's 50 times as many babies that pass away in the crib than pass away from car accidents. And it's really a surprising statistic. And we can't come out and say we can prevent an undiagnosable issue, but if parents feel like this will give them an edge on an issue like that, that's when we see people respond. And so finding ways to do that in a way that we're not scaring people, but just saying, hey, this is what Owlet has done, and highlighting the positive has also been really effective to help parents adopt the technology. So.
We launched our product about 2 months ago, and we are very glad to hear that there are really clients who got pregnant under the help of our device. So although we are lack of statistics, but I really hope that our device will help women to get pregnant easier. And I've already said that in China, most of us do not have GP, and I hope our products can help the women to ease their anxiety and to give them more medical help before and during and after their pregnancy. So we are ready for other products like a fetal monitor, which can be used also at home. In China, but not in the States.
From what our finding is, although our product is targeting to women, but for their spouse, from what we learned, they have more knowledge than their spouse. For men, even they have a better understanding about menstrual cycles, and they are quite exciting about our data-driven based solution.
So do you find then that you're speaking directly to the women who want to buy your product as opposed to their doctor or their employer or their insurance company? Is it really the women who are making a difference here?
I think it's not only for the women, and also their friends, their spouse, and even especially in China, their parents plays a key role in their decision.
Family pressure. Anyone else? I mean, I'm just curious because it seems like, the women are obviously, there's a huge desire, but in terms of mass scale, if you were speaking to a school or an employer or the insurance company or the medical community, the infiltration could potentially happen faster.
Yeah, I think that's probably for all of our companies, the goal would be, hey, if we can get this reimbursed by insurance and recommended by your doctor, everybody's going to have one. But what we found is that parents are very connected. It's such a big life change that social media is where a lot of those interactions are happening, and recommendations from friends from all of our surveys are a lot more powerful than even your pediatrician. So parents are actually looking to their friends who have just gone through it, saying, "What do I need? What don't I need?" And so that community and just the peer-to-peer recommendations, I think, are really powerful. In getting customers to adopt, something that's new.
The only thing that I'll add is as I will say, yes, the demographic seems to skew more towards female, more as the family manager of the healthcare situation, but certainly either parent that is taking care of children are hearing our message. But one thing that's been interesting to us, and I know this is primarily about baby tech, but a lot of us are also part of this, what they're calling the sandwich generation, where we're taking care of our babies and kids, but then also our parents and elders. So the ability to use technology, at least like ours, for both of those, is something that really resonates with the parents and others within that sandwich generation.
I've heard a lot of you today talk about data and collecting data. Is that something that you're actively doing? And if so, how are you using that information? Anyone?
Nowadays, our product just use the data of the client by themselves because we need personal data for everyone to draw a period curve for the client.
Our solution is HIPAA compliant, so it means we have a better privacy for the data. And the only usage for our data is currently to train our algorithm to make the prediction or diagnostic more precision. So that's all.
And I mentioned before, we're using data in many ways to drive analytics and help inform individual as well as population health trends and issues and things like that. But what I also wanted to show you is we're also using the advanced data technologies of the phone and tablet that people are familiar with. So things like Siri, augmented reality, avatars, and things like that to really guide lay people like ourselves through that collection of the data to make sure that it's of clinical quality, such that a doctor is going to be able to analyze it as if they had done the examination themselves.
So this is something we're really excited about. Owlet has collected the largest data set of infant biometrics and sleep that's ever existed. And our product isn't really a spot check product, so we're getting 12 hours on average of data per day, every 2 seconds on a baby's biometrics, and its heart rate, temperature, oxygen levels, and sleep quality metrics. And so that's really exciting for us. And I think if you think about, the pain of trying to read all of these books as parents, you're trying to figure out what kind of child do I have here, and every child's different, and how does this apply to me? And it's really that personalization of healthcare. And as we build these data models, we can make sleep training more personalized. It doesn't have to be one size fits all, because we already know it's not one size fits all. And healthcare can be the same way. And so that's what we're really excited about with this data, is how do we now empower mom and dad in the home to say, I know how to help my child, not just the kind of the weekly baby center update that's generalized.
And yet so good, I have to say, for what it's worth. But so in terms of then sort of taking it to the next level or expanding your offering, are there big plans ahead for any of the companies that you can share today, or big announcements that you'd like to make?
Okay, for us, the fertility is just the beginning. So later product, since the technology behind that is platform based, so we can address more disease with more biomarkers. So we definitely want to focus on the reproductive health, baby health, and later we are going to address more to general health, fitness performance, chronic disease. So that's our plan.
I've said that we have some smart devices focused on women. So besides this fertility tracker, we also have the fetal monitor, and we also have a smart weight scale for women to use before and during and after the pregnancy. And also we are designing a smart skin for women to use on face because moms are always too busy to have a facial. Yes.
And for us, in terms of expandability, the back of our unit is a proprietary connector that allows you to attach additional adapters to turn Tyto into other peripherals. So while today we have a stethoscope, tongue depressor, and the industry's first ever rubber flexible tip otoscope, safe for parents, you'll see us be adding things like glucometers, pulse ox, strep, urine, you name it. We've built this so that we'll be able to continue expanding this as ever expanding kit for home healthcare.
2018 is going to be a really big year for Owlet. We're expanding. It's kind of confidential right now, so I can't share anything, but we would love for you guys to stay tuned, because there's some really exciting things coming out from Owlet. So
It sounds like, at least for you, well, first I want to ask Jeff, is he trying to put the primary care physicians out of business? Is that what's happening here? Because
Absolutely not. We actually become the bridge, the tool. One of the things that's different about our platform than anything else out there, at least that we're aware of in the telehealth space, is we don't have our own primary care physicians or network of doctors. What we're doing right now is we're already working with about 25 of this country's largest health systems, mainly pediatric hospitals, Miami Children's, Nemours, Dallas Children's. They're all currently rolling Tyto out for specific use cases. So we are currently not selling directly to consumers. I probably should have mentioned that before, but sometime later this year, that'll be our big announcement, is when we do sell directly to consumers, but when we do, it'll be to connect to your doctor of choice, not ours. And all we're doing is providing the technology and the platform so that that doctor doesn't have to be in the same location as you when the exam is done, but you will always need that doctor to do the exam.
that's actually sounds amazing. Kind of want to take that home with me today, and this, and I already have the Owlet. So, just when the new product comes along, let me know. But where am I going here? Sorry, lost my train of thought. So, in terms of benefit and in terms of just sharing the biggest tech growth for you guys? What do you think? Where do you think it's going next? I mean, what's going to be the big trend this year, short term, long term, in the Internet of Baby Things? Where are we going? What are your big predictions? In general.
That's just in general. Yeah, I think there's a lot of really great kind of point solutions in the baby space, and I think we're going to see some consolidation so that the data sets can kind of integrate and add more value to solve real problems. So I think we're going to see that in baby tech for sure. Yeah.
Could you identify some of the real problems? Like, what do you think are the real we have fertility, we have fetal monitoring, we have all of the products here. What are some of the problems that maybe haven't been addressed yet?
Yeah, I think the challenge of, primary care is a really big problem. And what we're seeing here is a consolidation of a lot of tools and data, and it's complex, and there's not just a product that can solve it, it's a system and a suite of products. And so that's one. I think sleep is another great example of a really big problem for new parents. And I think we're going to see, night lights and products like Owlet that are collecting data from the baby, and thermometers or thermostats all start to integrate to optimize sleep for baby and to help them sleep longer and better without any intervention. So I think those are two problems that would come to mind. And then I also think that this data is just gonna start to get more insightful and less kind of quantified and raw. I think we're going to start to have more of an artificial intelligence that comes out just says, hey, this is what you do next. So.
I agree with that completely, and what I would add to it is, to me, the big trend is going to be this connectivity, both, as Kurt just mentioned, the aggregation and the communication between the data sets that are being collected, but also the communication between the devices themselves. Quick show of hands, how many people here got either a home appliance like Alexa or Google, or a home speaker system like a Sonos or something like that over the holidays? So, I mean, I could tell you last week I was setting up for the first time myself Alexa with a Sonos system, and I was just blown away how devices in my home are now communicating with each other, kind of behind my back. I was a little scared as well, but when you start thinking about the capabilities here, so as an example, my wife's a type 1 diabetic, and she often gets into a dangerous condition called DKA, which is very dangerous for a diabetic, but there's signs that we can collect, things like lack of sleep, and stress levels. And over time, as these things are collected from our watches, our activity trackers, when our home devices detect that perhaps we're not adhering to our normal sleeping or eating patterns, and then they share that with devices like you're sitting across the stage here, you're going to be able to see a much greater just awareness and ability to manage our own healthcare. And to me, that's the most exciting the exciting thing that I'm seeing on the horizon is the interoperability and the communications between what all of us are doing.
Do you have anything to add?
Yes, I think on Chinese markets, there is a special situation is that most of us do not have GP. So the device providers, not only the baby tech, also the health tech providers, do not only provide their devices, they also do some education for the consumers. But among the education, there are scientific knowledge, there are traditional Chinese knowledge, and there are some fake knowledge. So I hope that more and more scientists and professional doctors can be involved in this market.
You need TytoCare in China.
So in terms of trend, I think just look at the software industry. So PC standalone software, the cloud-based software, the mobile software. Healthcare is a little one step maybe slower than the software development, but I think we are catching up. So go mobile, go personalized. So data-driven, supported by the AI, it definitely is a big trend in the healthcare.
It's very true. So just, I do want to give a few minutes for questions if there are any, but just quickly because we talked a little bit about Google Assistant and also Amazon Alexa, the platform, and it's something that, at least from my experience here at CES this week, everyone is talking about voice everything, integration with Google Assistant, everything. Every product I go to, their biggest announcement is, oh, now we're integrated with a voice platform. So I haven't heard that on this stage yet today, but I'm wondering if it's happening.
So one of our investors is the Alexa fund at Amazon. So, yeah. Well, and they've been kind of pressuring us to, hey, build out a solution, build out an integration. And we're like, nah, I mean, the parents aren't there yet. And we were so surprised because we did a survey of our customers and we found out that 24% of our customers own an Alexa in their home. And we don't have like our income demographics actually match very closely to the United States. So parents are adopting Alexa. We have 2 in our home. Our kids talk to Alexa. They interact with Alexa. So I think for us, it's going to be really interesting now that they have kind of the video solutions that can sit on your desk or not on your nightstand to be able to talk to Alexa and say, hey, how's baby doing? You can see a picture of a live video stream of your baby and see what their vitals are, and it'll talk back to you. I think that's a really kind of great use case for Owlet.
About this, because Google is blocked in China. Yes, it's very sorry. But as a smart device, I think it's designed for women who want to control their life in a smart way. So although fertility is a quite private thing, but I think yes, we may cooperate with some other platform in the future.
I'm envisioning by integrate with Google over Amazon, someday the customer can ask Alexa, is that a good day to have baby in a day?
Is today a good day to have sex? Jeff, did you have
Yeah. The only thing I'll add is not so much voice activation for us because that's a little farther off. I mean, people right now are just starting to get used to being able to do these things themselves. But it's more just the ubiquity that folks like Amazon and Google have built. So, for instance, one of the things we're asked to think about over the next couple of years is delivery. A doctor finds that a patient has a certain situation going on and says, well, how do I get Tyto into your hands in the next 40 minutes? And that's when they start talking to us about things like Amazon drones and things like that says, hey, if I can get this thing into a patient's hand in under an hour and then they can get their data to me, that's even taking this to a whole other level.
That's amazing from a time-saving perspective, and just, I mean, in healthcare, time is everything at times as well. So that's really huge. Are there any questions? We're running out of time. Go ahead.
Hi, I'm Sylvia. I'm from Hugsy. We're comfort and care products for babies. And a problem we've faced a lot is like in the educating of parents about new concepts or new technology. And I was wondering if any of you could answer, how did you overcome that challenge of educating your customer, especially as parents and women, they have such limited time when they're taking care of their kids, to just get that solid information through to them as easily as possible.
So when we first launched, we thought we could just put Google Ads next to video monitors and people would buy our product. And it was like $1,000 cost per acquisition. It was crazy. And so we're like, wow, they don't get it. And that's kind of how we knew retail would be unsuccessful too, because you walk by it like, what's that baby sock? I don't need that. And so video advertising through Facebook, where you have kind of short and medium length videos that kind of go through your value proposition, that's where we found a lot of success to build awareness, education, and then it also drove conversion at the same time. So.
For our product, because basal body temperature (BBT) has been proven effective for at least decades, I think. We only provide an easy way for women to track their BBT. So I think our challenge is that to tell them our sensor is the most accurate one, but our product have been FDA approved as a medical Category 2 device.
And similarly, for us, it's, first of all, in order to get approval from the FDA for a consumer medical unit like this, we had to go through all sorts of usability studies, literally, where where dozens of patients would have to come into a room and be able to do an exam on someone with zero instruction. So we had to make sure the platform itself was literally foolproof, bulletproof. But then also we completely embed tutorials. We make you go through tutorials, make sure you understand it. But most importantly, it's the platform itself that helps people understand how to do it. So for instance, our programs know what an eardrum looks like. It knows what the back of the throat looks like. It knows what a heart's supposed to sound like. So as you're doing the exams, it tells you. It will not let you go on to another exam until it has successfully captured an eardrum in clinical quality. Or it will not let you go on and capture the next quadrant of your heart until it captures that first quadrant loud, clear, so that when a clinician gets it, they're going to know what to do. So you've really got to build those types of things into the experience itself. People don't want to have to do something separately just to learn something.
I just want to add one thing that we really find at Good Housekeeping, especially with the consumers that we speak to across the country, is that when we talk about tech and use the word tech, they turn off. And these are, this is 40 million women across the country, all demos, all ages, in all honesty. But when we talk about benefit and solution, how it makes their life easier, how it solves a problem, how it saves them time or money or gains them extra me time, that's when people really turn on, and that's when they get excited. They don't care about tech, but they care about their own life, and they care about making their life easier, better, and the life of their families easier and better, and that's where a lot of these devices come in. So that's something to keep in mind as well. Don't focus on the tech. Who cares about the tech, honestly? But focus on the benefits. Oh, we're getting kicked off.
I think user experience is a definitely they make them benefit for the user. Yeah.
I think we're getting kicked off. Any closing remarks from anyone? I don't want to kick anyone off the stage. Another question? Yes? No? Okay, we're good. Well, I found that particularly interesting and enlightening. I'm really excited to hear what you guys all have coming next. Of course, I'm sure the panelists are around if any of you want to speak to them afterwards or check out their booths. Many of them have booths in this room. In fact, I think everybody does. So, and I would say enjoy the rest of your CES.